we're going to go through is like special tests. So these are the tests that we're going to look at for more diagnostic-based material and finding out what's going wrong in the knee itself. So the first ones we're going to look at are mainly like main ligament structures. So we have 4 major ligaments in the knee, which consists of an MCL, which is a medial collateral ligament, an LCL being your lateral collateral ligament, an anterior cruciate ligament, and an posterior cruciate ligament, which is inside your knee that cross over in between. The first one we're going to look at is testing the MCL, and this is simply done by just letting the patient completely relax in your arm. I take a firm grip on her calf, and I can place my hand here on her femur, and this is where I'm putting a valgus stress on that MCL and pushing down. And here you sort of had a springy sort of feel because the ligament's a bit of spring in a ligament. In a patient that would have like a positive test for this, you would see a lot more laxity, so you'd see much more movement, and also with a complete rupture you'd be able to move that knee, really gross movements. And from the same position I can test the opposite side, just bringing it out and just pressing pressure on the other side, and that's doing the LCL. And then we have, if we bring that knee up to, we're going to have here a posterior sag test. So this is where we're looking for posterior cruciate ligament ruptures. So here we're going to look along the line, and we're looking for the tibia on the affected leg dropped already, which will indicate the PCL is being ruptured, and you'll find a lot of gross movement when you're bringing it into like an anterior draw sort of thing. Testing for the also for the PCL, like if that's evident, then you've got to be careful with certain tests because you're going to get a lot of movement forward. So you don't want to like get a false positive on like ACL special tests, such as Ligaments or the anterior draw. But you can also do a posterior draw from this position, where you basically bring it back into a neutral position if it is ruptured, and then you can press it back down. But just from the posterior sag itself will indicate a posterior cruciate ligament rupture. Place that leg flat for me again. For the ACL, we're going to look at doing the Ligaments test because it's proven to be the most effective in finding ACL ruptures due to the angle of the knee being stressing the ACL the most. So you put your knee underneath just to help guide and support the leg of the patient. And then by supporting one hand on the femur and one hand on the gastroc underneath, we're just going to anteriorly draw the tibia away from the femur and stressing that ACL. Again, positive here would be either a complete rupture with lots of laxity, or just pain on grade 1 and grade 2 ACL injuries, and mild to moderate sort of laxities as well.